So, a very good afternoon once again. And we talk a lot about, we know a lot about antenatal checkups and what all packages to give and recommend to the patient when of infertility or recurrent pregnancy loss. But when it comes to a 65-year-old annual health checkup, it's a gray zone for us. And we really don't know much, excepting we just look up some blood test packages and get those done. So let us see what health is all about and what we should be doing for annual checkups. The WHO defines health as a state of complete physical, mental, and social well being. Physical health includes ability to perform daily tasks, have energy, and maintain a healthy weight. Mental health includes ability to enjoy life, adapt to change, and balance different aspects of life. And social health means ability to make friends and continue good relationship with our relatives and friends. To begin with, I quote Tao Parchao Lynch, who's a 97-year-old yoga teacher, and she says, I don't believe in age. I believe in energy. Don't let age dictate what you can and cannot do. So, friends, coming to annual health checkup for 65-year-old women. The aim is to screen for medical issues, to assess risk for future medical problems, and to update on vaccinations. So, when a patient walks into our OPD clinic, the physical examination starts, and we start with a blood pressure check, which is done at least once every year, height, weight, body mass index, waist hip ratio should be checked at every examination. The target of BMI in Asian women is 22.5 kg meter square, and the waist hip ratio is a sensitive index of obesity. Should be zero point 0.8 or less in females. The waist hip ratio is a key indicator of visceral fat stored around abdomen, and the values of greater than zero point 0.8 is linked to increased risk of coronary artery disease, diabetes mellitus, and certain cancers. The muscle strength should be checked. During the examination, the doctor should ask questions, leading questions about depression, anxiety, diet, exercise, including advice on exercises to improve body balance, which can reduce the person's risk of falling. Alcohol and tobacco use, caffeine intake should be asked for, whether there are any symptoms of urinary incontinence. In fact, even for medicines being taken by the patient and risks of drug interactions should be looked into. The blood pressure is important, should be checked yearly and should be checked more frequently if there is diabetes, heart disease, kidney problem, or if the patient is overweight. There is a there is a first degree relative with high blood pressure. The blood pressure should be systolic if it is systolic 130 to 140 by 90. Then this is stage 1 hypertension, and readings above these are called stage 2 hypertension. How to measure blood pressure is something we've all learned, and we should apply that. Now, coming to the blood tests, very important, the CBC and as well as the peripheral smear, which looks for different types of anemias and leukemias. And lipid profile is extremely important, though we generally tend to overlook it. We'll soon get to know why it's important. HbA1c, fasting blood sugar. In the kidney function test, serum creatinine is important. In the LFT, the SGOT and the SGPT, thyroid profile is extremely important. Usually, elderly females are deficient in vitamin D and vitamin B12, so both these should be checked, the RA factor, and we all are doctors working in the operation theaters with patients, so hepatitis B antigen, HIV, and HCV viral markers should be looked for. Lipoprotein B should be less than 130 milligrams per deciliter, though CA 1 to 5 is not recommended in the guidelines, but many a times we have discussed about it, and it's a good cancer marker for ovarian cancer. High sensitivity C-reactive protein should be less than 2 milligrams. And what does it denote? It denotes high levels indicate inflammation. In patients of coronary artery disease and diabetes, it is a marker for future cardiac events and stroke. So C-reactive protein also is important. Coming to blood cancer, breast cancer. Mammography is performed to screen women to detect early breast cancer when it is more likely to be cured. So mammography, there is a role for mammography, and we shouldn't be scared, and neither should our patients be scared of getting a mammography done, because it actually can pick up the earliest breast cancer, and the cure rate is fantastic if it is picked up early. Women between ages of 40 and 75 should have a mammogram every 1 to 2 years, depending on the risk factors. Women with a family history of breast cancer have an annual mammography starting 10 years prior to the age at which the first degree relative was diagnosed with cancer. So as we know that if the mother had breast cancer at the age of, say, for example, 46, then the daughter should get the mammography done starting at the age of 36. If there's a family history of pancreatic, prostate, colon, breast, ovarian cancers, then again the patient falls into the high risk, and mammographies and MRIs have to be done every year. If the patient happens to be BRCA1 and 2 positive, then the risk of breast cancer is higher, and additional testing like MRI, a 1 year MRI and the other year mammogram should be done. There is a benefit of breast self-examination, and it can find breast cancer and can save lives. So breast self-examination is a must for all of us. Cervical cancer screening. After 65 years, most women who have not been diagnosed with cervical cancer or precancer can stop having screening tests as long as they've had 3 consecutive negative pap tests. So this is important. Osteoporosis screening. All we know about is probably the DEXA scan, or some of us just the calcium levels. So let's see what they have to say. All women of age 65 or older should have a bone density test, that is a DEXA scan, every 3 to 5 years. Besides the intake of calcium and vitamin D supplements and calcium rich diet, exercises should be discussed. So screening for sarcopenia, this is new, and Dr. Jyoti Bhaskar spoke about it in length in the last webinar. So I'm just re-emphasizing it. Screen by using SARC-F form. And what does this SARC-F form contain? It contains a questionnaire, and the questions are: how much difficulty does the patient have lifting a 5 kg weight? How much difficulty the patient has walking across a room, difficulty in rising from the bed or chair, and how much difficulty climbing stairs? Has there been any history of falls? And the diagnosis for sarcopenia is based on muscle mass, muscle strength. How do we determine the muscle strength? By the grip strength test, which uses a handheld dynamometer, and the chair rise test, which we've been talking about in our groups. And the chair rise test is nothing, simply that the patient is asked to get up from the chair without the support of the arms, and at least the patient should be able to get up 5 times in 15 seconds. Physical performance. The gait speed test is checked, and a walking speed of more than 5 seconds to walk 4 meters indicates that the patient is at increased risk of morbidity, disability, and frailty. What are the exercises that we can recommend? Is it just a walk, a quick-paced walk, or yoga? No, there are resistance training exercises. There are handheld weights, resistant bands like this picture is showing. The squats are very important, and so are the lunges. Squats, why squats? Because they increase the strength of the hamstring muscles, the calf muscles, as well as the gluteal muscles, which balance our whole body. Yoga, of course, is ideal for elderly patients, and they look after our weight bearing, resistance training, balance training. Not only all this, but yoga brings us closer to our spiritual self, gives us gives us a better life, better quality of life, a stress-free life. The pranayams and the meditation is excellent. Then the weight-bearing exercises, walking, climbing stairs, dancing, All these are not only entertaining, but they are also very good for, at this age. These help to strengthen bones as well as muscles, improve our balance and coordination, and thus reduce the risk of falls. They build our bone mass and prevent bone loss. So, this is the importance of exercise. Lung cancer screening. Lung cancer is the topmost cancer. An annual screening for lung cancer with low dose computed tomography is indicated if the age is between 50 to 80 years and the patient smokes. But in case there is no history of smoking, then an annual chest x ray suffices. Colorectal screening. This is something which we Indians have not touched upon generally, and it is important because we do get to hear quite often about colorectal cancers. So, from 50 to 75 years, one should have screening for colorectal cancer on a regular basis. The US Preventive Service Task Force recommends a stool-based fecal occult blood or fecal immunochemical test every 2 years, a stool DNA fit test every 1 to 3 years. These two tests are readily available in the good labs, in the good path labs, and colonoscopy if needed if the results are positive. So if a DNA fit test is positive in the stool, then a colonoscopy is indicated. Otherwise, colonoscopy has to be done every 10 years. One may need a colonoscopy more often if one has risk factors for colon cancer, which includes a history of ulcerative colitis, personal or family history of colorectal cancer, history of growths in the colon called adenomatous polyps, a family history of inherited colorectal syndrome. People aged 76 through 85 should talk to their healthcare provider whether to continue to get screened or not. Now, cardiac screening, very important. It's a major cause of morbidity as well as mortality in 60 plus women. And we should know all about how to prevent it and how to find out whether we have a tendency to a bad coronary artery disease. So, cardiac screening includes standard tests like blood pressure monitoring, regular checks to maintain hypertension, a major cardiovascular risk factor. Lipid panel, blood tests to assess cholesterol levels, LDL, HDL, and triglycerides. LDL is the bad cholesterol, and in fact, in an LDL of more than 60 milligram per deciliter is supposed to be bad, and in fact, statins should be started. An ECG can identify arrhythmias. Consider additional tests based on risk factors like a carotid ultrasound. Now, what is a carotid ultrasound? It checks for plaque buildup in the carotid arteries, which can lead to stroke. So, what does an echocardiogram does? It evaluates our heart function. And what does an ankle brachial index tell us? It tells us about the peripheral artery disease, which can be a marker for increased cardiovascular risk. So all these tests are done if indicated. And when are they indicated? We'll just talk about it. So the Lipid Association of India proposed low-density lipoprotein cholesterol, that is the LDL-C goals, have a target of less than 50 milligrams per deciliter, especially for patients who are at high risk. So all South Asian Indians, that is Indians, come under the high-risk category for heart attacks. So therefore, our target should be less than 50 milligrams per deciliter and not 100 milligrams as shown in the path lab range. So what is a CT coronary angiogram? We hear about this. So it is used as a screening tool, in fact. It is considered as a potential screening tool for coronary artery disease as it provides a non-invasive way to visualize plaque buildup and blockages in coronary arteries. The benefits are that it is non-invasive, it gives a detailed imaging, and it detects a risk for CAD pretty early. What is and how do we calculate the calcium score test? This is calculated by the CT angiogram scan that looks at how much calcium is in the coronary arteries. Calcium score of 0 indicates that there is no calcified plaque. Who should get a calcium score test or a CT angio test? Well, people at increased risk and who have a family history of heart disease, have a history of high cholesterol, who have diabetes or high blood pressure, are overweight, that is, who have a BMI of 22 and higher. Obesity, when they have a BMI of 28 and higher, who have an inactive lifestyle, and in whom the apolipoprotein B is more than 130 milligram deciliter, and those who have non-alcoholic fatty liver disease with fibrosis grade 2 to 3. And then we should also visit a dermatologist. What does the dermatologist do? He or she checks for signs of skin cancer. Especially, one should visit them if one has to get the moles checked. If we have moles, there is any change in the size or in the nature of the mole, and in case we develop hirsutism or alopecia, and of course for skin maintenance for anti-aging and hyperpigmentation. Eye examination includes fundoscopy to check on the retina, especially if there is a diabetes, to rule out diabetic macular degeneration, to look for glaucoma if there is a family history of glaucoma, and also for the vision test for appropriate eyeglasses. Hearing test. Have your hearing tested if you have symptoms of hearing loss. Otherwise, an audiometry is recommended every 3 years in those who have no hearing loss. Dental examination, extremely important. Go to the dentist twice a year for a checkup as well as cleaning. The dentist will evaluate if you need more frequent visits, talk about root canal treatments, implants, crowns and bridges, and cavities. Do ask the doctor to look for all these things and discuss them. Immunizations. So the three main immunizations, before we get confused with the long list, are initially there should be 1 dose of Tdap, and every 10 years a TD, that is a tetanus and diphtheria booster. So first of all, let's get a Tdap done, all of us, and then after 10 years, a TD. I think the best thing to get done is an annual checkup and immunizations on our birthday. We can give ourselves a gift. Then the flu vaccines should be taken every year. And this should be done by the end of October, because that is the time when the flu season begins. Then varicella zoster vaccine must be taken because shingles is very painful and troublesome. So 2 doses 2 months apart should be taken. And pneumococcal vaccine is given to all adults who are 65 and older, 2 doses 1 year apart. Hepatitis B should be taken as a booster by us, 2 doses 1 month apart. So this is about the immunizations. In summary, a good history, general examination, lipid profile every 3 to 5 years, BP estimation every year, blood sugar every year, X-ray chest every year, and in patients with high risk, calcium scoring and CT angio every 3 to 5 years. Then if symptomatic or diabetic or hypertensive or other risk factors, then a stress echo every year. Since we all have very high risk because we are South Asian descent, lipid profile every year should be done with targets of LDL being 65 milligrams deciliter. Target of BMI in India should be 22.5 kgs per meter square, and targets for waist-hip ratio, which is a very sensitive index for obesity, should be 0.8 in males and 0.9 in 0.8 in females. One more parameter which should be done is the C-reactive protein levels, which should be less than 2 mg/%. High CRP levels indicate inflammation, and in patients with coronary artery disease or diabetes, it is a marker for future cardiac events and stroke. Drugs can be taken to bring them down, and there is a positive rule for using high-dose statins in this subset of patients. It's important to stress on the role of ideal body weight, BMI, and hip weight ratio, because ultimately obesity would be the mother risk factor for so many lifestyle diseases like CAD, diabetes, osteoarthritis, and cancer of the colon. Thank you so much.